Our program originated in backpack medicine as a homegrown idea to provide medical care to homeless by meeting them where they are at in encampments, on the streets, across the county. What started out as just a physician from Ventura County Medical Center Family Medicine Residency Program and our program coordinator, James Boyd, with a backpack hiking into the bush, grew into a multidisciplinary team once we realized the significant socioeconomic barriers to healthcare our patients faced. A doctor can't fix homelessness, nor can a doctor fix insecurity of food, but multidisciplinary teams can try. Under the guidance of the County of Ventura, it has since grown to be a collaborative partnership across jurisdictional boundaries that not only provides traditional medical interventions, but wraparound care to the hardest to reach, most chronic cases in our community. It's a partnership to address a humanitarian crisis.
Homelessness has been a problem that we've had to tackle for many years, but in the past several years, we've really seen an uptick. A lot of reasons. Obviously, COVID has a role in that, the economic impacts of COVID especially. So that really puts the impetus on us to work with our neighboring agencies and to make a difference. We have to work together because it's a regional problem and it's going to take a regional solution. We have task force, we have events like this, Backpack Medicine, where everybody comes together and says, we're going to fight this. We want to be the leader in this. We want to create models that even other areas in the state can use.
My name is Henry Villaseñor Vasquez. I live in Oxnard, California. I was homeless. It was awful. It was awful. And they helped me and they hooked me up with other programs here that are great. I mean, look at me. I was down. I had nothing. It's new to me and I panicked at first. I panicked. Oh, what am I going to do? All this responsibility now, rent, bills, groceries, laundry. I'm not used to that. But now they taught me how to take care of myself, how to go out and get things now.
One of our programs through the clinic is the Backpack Medicine program, where we come out to try and see some of the homeless folks in the community and see if we can help them with medical care, with housing, addiction medicine, mental health services. We've got a lot of different agencies throughout the county come out to the Backpack Medicine program. So today we have our Healthcare for the Homeless team with doctors and nurses. We've got housing people from both the Salvation Army, from Oxnard City. We've got mental health services through Ventura County Behavioral Health. We've got our addiction medicine team, which works through the Healthcare for the Homeless clinic as well. I think that's the great part, is when the Backpack Medicine team all comes out together, is we can really tell people, you know, we've got a lot of people that can get you directly connected to the services you need. So, I mean, if it's a mental health concern, we've got the behavioral health team that can get them right into an appointment, into a clinic. If it's an addiction medicine issue, we've got a counselor here. We can give them a Narcan kit and we can get them directly into the program, instead of saying to them, oh, here's a phone number you can call, or here's a place where you can go and get something else. A lot of times that just doesn't happen, right? The follow-up is not always there. So when we've got the whole team here at once that can get them directly into a program or into an appointment or into a clinic, that's when it seems to work best.
It's hard for a person like me when you don't have nothing, you know? I'm never gonna go back to the bad, never. I feel so good and these people are so trusting. I trust them. I couldn't trust nobody.
We have so many different moving pieces for these, because it's not just county property, it's not just city property. So, you know, we have to come together as a bunch of partners coming in to try to do this job. And so it takes all of us as a team to make it happen.
The homeless population has exploded, you know, in Ventura County, specifically within Oxnard. So we had to get those services available to them, to provide them with long-term solutions. Right now, we're day-to-day, and you know, we're continually meeting with the Salvation Army, since they're our outreach workers here within the city of Oxnard. We're in constant contact with them, with the public health agency, with behavioral health, with all the shelters and the other resources that are available to actually get the homeless population housed as well.
So this is a really great opportunity for the County of Ventura and the City of Oxnard to be able to work together and leverage our resources to address the issues that our unhoused population are currently facing.
I think collaboration among the departments and the different cities and jurisdictions, that's the way to go, plus our nonprofits that are working with our homeless people and getting out of our silos.
There's not too many places that have so many programs like Ventura County does. We're blessed here. I got away from drugs, I don't drink, I don't use, nothing. And if anybody out there does not believe me, well, take a good look, because it works.
We can't hope for or expect people to come to us. We have to go to them. And that means days like this where we actually go into riverbeds, we go into encampments, and we do that proactive outreach to make sure people know the whole host of services that are available to them. And if there's any way we can help, we want to make sure people know we're here to help them. We're here to provide those services. And we go out to where they are to do that outreach.